Women, an in-depth exploration of the world of women today with Sandra Elkin.
Good evening and welcome to Women. Our topic tonight is cosmetic surgery. My guest is Dr. Sida Prono. She's a practicing plastic and reconstructive surgeon. She's a clinical associate professor at Downstate Medical Center and is on the staff of Booth Memorial Hospital, Long Island Jewish Hospital, Wycoff Heights Hospital. Dr. Prono has been a practicing plastic surgeon for 15 years. Welcome to the show.
Thank you.
Can you tell me some of the reasons that people come to a plastic surgeon?
There are mainly two, either reconstructive or cosmetic. They come mainly because of something that they feel is not right in their bodies or their faces, or if they have had some kind of injury, they would like to have some reconstruction done, or if they're born with some congenital deformity.
Is there any one kind that you have predominantly?
No, I do both cosmetic and reconstructive.
There are a lot of myths about plastic surgery, aren't there?
They sure are.
There was one, when we were speaking on the phone a few days ago, there was one that you told me that really surprised me. Do you remember?
Yes. To this day, it even surprises me when somebody talks to me and we go over some certain kind of surgery, especially skin graft, and they talk about what kind of plastic material am I going to use. It's true that we use plastic materials, but not for skin grafts. There's some other things that are very intriguing to me, why people, after reading so much in the papers, still talk about a plastic surgeon as a person that can do any kind of surgery without any scars.
Oh.
This is impossible, and we do get scars. It might be less noticeable than others that you have had in the past, but they do have some kind of scar present at the time of the surgery.
So to think that there are no scars in plastic surgery is just absolutely wrong.
Yes, this is one of the other fallacies. A lot of them think that because you're a plastic surgeon, you can correct something and nobody's going to see anything on it. It might not be so noticeable as before, but you're still going to have some scar. And it's something that patients think that it couldn't be, it can't be true because we're plastic surgeons. Other things that because of the exposure that they have to either the TV or movies, that you can reconstruct the whole face, reconstruct the whole body. And this is, you can do certain things according to what you have, but you can't rebuild the whole body to look like an actress or somebody with no scars or no deformities in their faces.
So I couldn't come into your office and say, I would like a nose like this and hand you a photograph?
This has happened to me, but I can only do, or anybody can do, according to what you have in your face, your features, your height, your weight, what you have available to work with. You can't, it's true that we can add certain things to it using either bone or cartilage or plastic material, like some elastic material, but you cannot look like an actress, any specific one, because you don't have the face to go with that feature. And that has happened to me, where they specifically want a certain advertisement because that's the coloring of their skin or the coloring of their hair. They want that. You can't do it. You cannot promise that. And this does happen.
So people are really confused about what's possible and what's not possible. Is there also a confusion about the time involved?
Yes, a lot of people feel that as to straight cosmetic surgery, they feel that it should be started early or late. It depends of what is being done. If it's straight cosmetic surgery for an aging face or a relaxed skin, sometimes in some centers they start doing them earlier. When I mean earlier, in their 40s or so. You don't have to wait until you're 60 or 70 to have a facelift. And if it's indicated, that's the main thing. A lot of people feel that by just coming and saying, well, I want a facelift, if it's not indicated, nobody's going to do it.
Yeah.
It's just impossible.
I'd like us to get into breast surgery a little bit. Lots and lots of women have silicone implants. I understand that silicone is no longer legal in this country. Is that true?
Injectable silicone for breast. Injectable silicone is being used for small defects, like a small wrinkle or a slightly depressed bone, but very small amounts. The injectable silicone is being used in Mexico, in Japan, in Canada, but not in the United States. It's not approved by the FDA.
Why did the FDA take silicone off the market?
At the beginning, when it was being used, it was injected freely, and frequently was injected to an extreme to increase the size of the breast. And there has been reports of necrosis or death of the skin because of the pressure. Also, if the silicone was not injected onto the breast, but it went right into the breast tissue, then it would become like a bag of marbles. And if any cancer would develop, it would be very difficult to determine whether it was the silicone or whether it was actually a tumor. And there has been some reports where they have had surgery done thinking that it's cancer, and it turns out to be just the silicone that had been injected previously. So it's very hard for anybody that has had injections of silicone to examine themselves, or to have a surgeon examine them, or any doctor, if they do not know they have had silicone injections, and decide whether it's really a cancer or any kind of tumor or the silicone injections. It has also traveled, and some of the women that had injections into the breast had traveled down into the side of the abdomen or away from the breast.
What happens when that happens?
Well, what happens is that they feel some kind of a lump in the area where it has traveled to, and usually it's taken out, and then they find out that it's the silicone.
If a woman came to you and was rather determined to have silicone, would you strongly advise her against it?
I have still calls for the silicone injections. We're not doing the silicone injections, are not, as I said, are not approved, although it has been found that some areas they're still bringing in the silicone from the other countries, but it's not a silicone approved by the FDA here. And apparently it has some kind of either it's not properly prepared, we don't know why, but it's still given troubles. But what we're using now is these elastic implants, which is a silicone sheath filled with this gel. And this stays in its place, doesn't travel. It hasn't been found to be carcinogenic. And it's a relatively easy procedure to perform, not deforming at all as to scars. And it doesn't travel like the silicone did. So if they don't want the implant, then I tell them that I don't know where to send them because I don't know of anybody that is doing it.
There are other kinds of cosmetic breast surgery other than the silicone, other than for cosmetic reasons, aren't there?
Well, since 1969 or 1970, it has been becoming more popular to do some kind of reconstruction after either radical breast or a simple mastectomy for benign lesions. Sometimes some women have a very cystic breast or a lot of fibromas in the breast, and then it's advised that maybe the whole breast should be evacuated, leaving a good sheath with the areola and the nipple in place. And a lot of them have it done at the same time, if it hasn't been a cancer, to put these implants in. It's satisfying for the patient in the fact that it's not a deforming procedure then. It's very psychological, traumatic to the patient to have a breast off, and even if they have in the future ideas of reconstruction, to see this flat chest in the one side and not in the other. And this is why I think that more and more surgeons are working together with plastic surgeons whenever it's possible, so that the reconstruction is planned as soon as possible. After the radical breast, where they have the cancer and they have to do quite a bit of excision, we usually wait at least 6 months until that tissue is ready for it.
Would you advise women to consult a plastic surgeon and perhaps plan a little bit ahead with the surgeon that's going to do the mastectomy? Or
well,
whatever?
I don't think they have to consult the plastic surgeon, but I think that the surgeons in general, whenever possible, if the patients question them about this, shouldn't push the woman aside. I think it's a very traumatic surgery, a radical mastectomy. And if it turns out that it's not, it's more or less a localized cancer, it's very early, maybe with having a consultation with the plastic surgeon ahead of time, if it is possible in the area, then they could work together in planning the incisions for the surgery. But at any rate, of course, the main thing is eradicating, if possible, the cancer. So in spite of the fact that it would be advisable to use one incision or the other for the surgery, it's better to think of the cancer first and then worry about the problem of reconstruction. But I think psychologically, if the woman has a hope that something might be able to be done, her attitude might change and might accept it easier. Although it might be to your surprise that only about 20% of the patient that has had mastectomy look for something.
Yeah, I am surprised.
A lot of them feel that, well, that's it's a stigma, true, it's a scar, but it shows that she has courage, that she's still putting up with this deformity.
That really surprises me, because I assume that part of the trauma is, you know, losing the breast and the look of the thing. You know, I would think that, you know.
It is, but I think that some of the women maybe, as I said, they say, well, I went through it and that's it, and they might be very pessimistic and not looking forward to going through more surgery too, you know, and feel, well, I will make it. So why bother with any reconstruction?
There's another kind of corrective breast surgery that we discussed earlier, and that is either enlarging or diminishing the size of one breast when there's a unbalance.
Right. Well, there's some patients that are have very large breasts, and of course then you can do a reduction mammoplasty, reduce the size, and there are different methods, and it depends on the size of the breast to decide what kind of method you're going to use. But the important thing, or the one thing that is even more so when a woman has both breasts are enlarged, are the young women that come to you with a asymmetry of the breast. This makes them feel like they're freaks. And
but by young, how young do you mean? Do you mean teenagers?
Right. I have had some girls that are 14, 15 years old, and they come with their parents, and this has been a problem. And we usually wait until their menses are normal and the growth of that breast has stopped. I have not seen any hormonal treatments, any kind of hormones that are given that would increase the size of the one that has been
is that
reduced.
sometimes the treatment that's offered?
Oh, some doctors give them that before they finally send them to have something done or examined. Sometimes they're so big that the difference is so much that you either have to enlarge one side and then reduce the other. Or sometimes just with increasing the one side is enough to make it more even.
It could be a very traumatic thing for a young woman.
It is, because they don't like the idea that they have to get undressed in gym in front of others, and it's bad enough at home, but being exposed to others, this is more so. This is too much for them.
There's some people who come to your office and you have a very hard time telling what's really the problem, what they really want done.
Yes. Sometimes they come with an excuse, and then after you question them and take the history, you find out that it's another excuse what they want. I had once a gentleman that came, and he said he just wanted the scar on his chest revised, improved, because he had had some chest surgery. And after talking to him for a long time, it finally turned out that what he wanted was his nose, and he blamed his nose for not getting a job. And this is an insecure person, and you have to be careful of how you get involved with these people and how to treat these people, because sometimes you do one surgery and think that you have done a very good job and you're satisfied with your work, yet that person is not going to be satisfied, and then they're going to revert to another area of their body that they're not satisfied with.
Just
so
keep
there's
wanting
a
more and more?
constant one operation after the other if you let them. So it's it could be that they need some psychiatric evaluation, and sometimes you can suggest to some patients, but a lot of patients don't agree with you. And what I do frequently, if I wonder how they're going to respond, I contact the doctor that have sent them to me and talk it over with them, thinking that maybe they can help in guiding them to a psychiatric evaluation before any surgery.
Are there some things that you just won't do?
Yes. If you have a person that comes with the idea that, doctor, I want my whole face done, well, I'm not going to touch this person, frankly. I don't think that she should be touched or he until proper treatment is given by their own family physician and psychiatry and everything else. Or if a person comes with a very tiny little hump or for a facelift at age 30, which I have had, a person with just deep lines on the side which are normal for that person, and they come for a facelift, I'm not going to do that until it's really indicated. I know that a lot of people say that, well, they're surgeons, they're ready with their knives, but I won't do it.
How do you tell when your face needs to be lifted? I mean, what are your criteria?
I don't go by the age. You have to see the patient and see really if it's wrinkled. You pull it up and back so that this way you see whether it's really actually excess skin and the skin is relaxed or not. A lot of times the lower part of the face is not bad, but the eyelids need it, and that would make a lot of difference. And yet the patient themselves think that it's a facelift. They're not thinking about the eyes, and the eyes are the things that they need.
What are you talking about, the eyelids? What happens?
In the eyelids, in the upper eyelids, they become very relaxed, and some people are so relaxed, even in their 30s, that the fold, when you open your eyes, almost touches your eyelashes. And that can be corrected, and it's a very nice procedure because it blends in the lines of the eyelid, and as a result, when you open your eyes, you don't see any scars. In the lower lids, some people have baggy eyelids, not meaning relaxed skin, but fatty tissue, which is around the eye normally and it has protruding through. And this is why if you look at some of them, you see that in some areas you might see a little bulging in the inside or on the outside instead of through the whole thing. Well, this again you can do and pick up the skin if there's any relax, and then take out that fat. And this gives you a nice line again because it's very close to your eyelashes, and it doesn't leave much of a mark.
Do you have any idea how many facelifts you do a year? Or most doctors do?
I don't know. I think it's becoming more popular now, any kind of cosmetic surgery. I think that years ago we all thought, even when I was doing general surgery residency, that it was prohibitive as to the amount of money that you pay for it. And I think as now people realize that it's not that expensive. True, in some areas there is, but you find more and more housewives and factory people and any kind of...
And men, too.
Men,
Yeah.
yes. There's a lot of men doing it now, and it's not... they always thought that females were the ones that were very conscious about their looks, but men are too.
I mean, there's equal vanity?
I think so. But it's if it becomes to the point where you're looking for help and you want something done and it's indicated, that will change a lot of times your personality completely. And a person that has been very shy and withdrawn can become very outspoken and go out. When you have a teenager, let's say, that is so conscious about their nose that they don't even go to a senior prom, which I had once, and after the rhinoplasty, she's working, going out all the time and all that. That makes you feel good, you know, and this is really indicated. Of course, she had a very bad nose, but still, it's very hard to see some people that get so concentrated in their deformities, which might not be noticeable to some people, and yet to others.
I'm getting the message here that you're not very respectful of frivolous reasons, that you really feel that there should be good, solid
right.
reasons for doing
I
it.
don't think that it should be done because your neighbor is doing it, having it done, or because she became 16 years old and I'm going to give her a new nose. Because I didn't have it, she's going to have it, my daughter. I don't think so. I think that it should be done if it's indicated. I think that the standards that our society now have set up, we have set up really, in thinking of a person has to be very thin, beautiful, or else you're not going to go out on a date, or you're not going to have a boyfriend, or things like that, has caused a lot of mental trauma really, because a lot of girls think that, or even fellows, are not going out because something is wrong, and yet their personalities are good, and they shouldn't be concentrating so much in this.
I think maybe people are becoming a little bit more aware of the effect that, you know, some of our advertising and so on is having on us. Let's talk about some specific operations. I'm very curious about the facelift, because I think that's probably the operation more women have than any of the others. Does a facelift last a really long time? I've heard both things.
Right. There's some authors that say that they have done some that last up to 8 years, 10 years. The average is about 5 years, I would say, and I think it depends also on the texture of the skin and how you care for the skin and things like that. I think that you cannot promise a patient a result or how many years it's going to last. I wouldn't. Never, because you can never say how that patient is going to do.
There are a couple of new operations that you told me about that I hadn't heard of before. Thighs and buttocks, and people actually have cosmetic surgery done there.
Yes. You might have read some time ago, there was one of the models, and it was in the newspaper, in one of the magazines, about the buttocks being done and reshaped. And I think that all the reading that we do, and is published about everything that is being done, is what's pulling housewives and ordinary, what we would consider ordinary people, not people on the stage or on TV or anything like that, to look for things like this. When you have somebody with big buttocks or big thighs, they want that removed. A lot of times it works out very good, but a lot of them forget that when you doing thighs and upper arms, which is another thing that is even more visible than the thighs, they have lost weight and they have the hanging upper arm on the side, but your head's going to have a scar. And again, going back to the original thing, they all think that because you're a plastic surgeon, you're not going to have any scars visible. You can't say that. You're going to have some scar. We try to put them in areas where are not as visible as possible, the blending with the lines of your face or of your body, but not all the time you can accomplish that. And it's discouraging to some of the patients.
What are some things that you can't do? I know you mentioned hands. You very often see a woman with a wrinkle-free face, and obviously, you know, her hands are not wrinkle-free.
Right. This is one of the things that I haven't seen anything reported on, and I'm sure you have noticed that some of the women, I don't know how many you have had here, but that are young looking in their face.
I don't think I would know someone with a facelift if I saw it.
Well, you can't see any difference except if you look for the scars. That's about it. And of course, some hands get very aged, very wrinkly, very early. And that we haven't been doing. And the other things that are very hard to do is like scars on the legs and the extremities. They do tend to become wide after you start using that extremity. So it's very discouraging for a lot of people that have had some kind of surgery or injury to their legs or arms that want that scar removed, and you can try to improve it, but you cannot eradicate it. That's the way we heal with a scar.
I guess that it's really important for people to find out what's possible and what's not possible before they plunge ahead.
Well, I think that they have to...
We have 1 minute.
To talk to the doctors, and I'm sure no doctor is going to promise what they can't do. And a lot of times they're explaining to the patients, and the patients then, because that's not what they wanted no scar or this, and then they say that it wasn't very good result. But it's hard, and the patients have to be truthful in accepting what can be done and cannot be done.
So in other words, if you go to a plastic surgeon and he or she tells you, I can do this and there will be no scars, then you should probably look for someone else.
I'm sure nobody would say that. Nobody would say that, because that's what is going to be, that's what they hear, and that's what they want. But no surgeon is going to say there will be no scars.
Okay, we're out of time. I thank you very much for coming. Thank you for watching, and good night.
Production funding provided by public television stations, the Ford Foundation, and the Corporation for Public Broadcasting.